Carroll University would like to extend a very warm welcome to our in-person and many virtual attendees to this event. I'm going to give a very short introduction to Dr. Helen Yaffe, our speaker this evening, because she's Zooming from Glasgow, and it's 1 a.m., I understand her time, and she's had a full day. So our schedule is about 50 or 60 minutes for Dr. Yaffe to go through her PowerPoint and explanation, her lecture. And then after that, we will be open to questions both in person and in the chat. Dr. Yaffe has been visiting and researching Cuba for many years, since 1995. A reflection of her research is in her recent book, We Are Cuba, a revolutionary people and how they survived in a post-Soviet world. There are also two documentaries that you can access online regarding Cuba. They're quite recent. One is on Cuba's response to COVID-19, and the other is on combating climate change in Cuba. Dr. Yaffe is a senior lecturer at the University of Glasgow in economics and social history. And without further ado, we would like to extend our gratefulness for this very late hour for her, because it's already March 31st at 1 a.m. And thank you, Dr. Yaffe, for accommodating us with your schedule.
Well, thank you very much for that great intro, and thanks for inviting me, and thanks to 300 people who have turned up on Zoom. I'm quite overwhelmed. So I will start by sharing my screen, and I would appreciate if someone can confirm that this is visible. And let me just make that big. And is that now big screen?
It is now.
Right, okay, great. I'm going to try not to speak too loud because I have sleeping children in my house. There is the faintest possibility that someone will wander in, but we hope not. Okay, so the PowerPoint presentation is sort of in two parts. One is an overview about Cuba's quite unique and exemplary response to COVID-19. And I'll be discussing a bit about Cuba's alternative health care model. And then the second part, I'll be looking a little bit closer at Cuba's biotechnology sector. Now, many of you may not know that Cuba has a biotechnology sector, which is world leading in some areas. But, you may have heard that Cuba is the only country in Latin America and the Caribbean to have developed its own COVID-19 vaccine. So there is an explanation for that, and it doesn't come out of the blue. Okay, so I'm going to start with a look at Cuba's COVID record at a glance. By the end of 2020, so the first year of the pandemic, Cuba had a total of a little over 12,000 coronavirus cases and just 146 deaths. Now, this is in a population, to remind you, of about 11.2, 11.3 million. So very, very low levels of contagion and low levels of fatality. The Cubans had responded, as I'll say, with a very strict lockdown, including closing their national borders. And Cuba is a country that relies on tourism revenue. So it was very hard hit for their economy. In fact, in 2020, they saw a GDP fall of 11%, which is extremely dramatic. It wasn't far off the experience of other Latin American, Caribbean countries, or even some of the advanced capitalist countries. Excuse me. So they took the decision in November 2020 to reopen their airports. And this was because the pandemic seemed to be under control. And what happened was a rush of particularly Cubans who live in the United States and Spain and all over Europe, going back to see their families and coming from countries with very high incidence of COVID. So the result was almost inevitably a surge in COVID cases. And in January 2021, in that 1 month, there were more cases than the whole of the previous year. And then they continued to climb. And Cuba had the worst variants. It had Beta and Delta. So just shortly after this, in March, 28th of March 2021, the fatality rate in Cuba was 0.58%, and that's compared to a world rate on the same day of 2.25%. It was actually higher in Britain and 1.81% in the US. So remember that the US had already advanced quite far with its vaccination program, and the Cubans had not yet started. On a year later, this is from, what is it now? For me, it's 4 days ago. This is the latest data when I was preparing this presentation. The fatality rate was 0.78. It had gone up. Cuba had a big surge over the summer, and the summer was the first time that since 1959 government that the Cubans have seen their healthcare system under stress. And that was still good compared to a world rate, which had come down as well, 1.27 and 1.22 in the United States, where there's been extensive vaccine coverage. Within 1 year of the start of the pandemic, Cuba had sent what they call Henry Reed brigades of Cuban medical specialists. These are specialists in disease control and disaster response. And they had been, 57 brigades had treated COVID-19 patients, 1.26 million patients in 40 countries. And they continue doing this work. So I'll also talk a little bit about where this capacity comes from. And Cuba was is still the only country in Latin America and the Caribbean to have produced COVID vaccines, domestically produced. It has so far, five COVID-19 candidate vaccines. 3 of them have already been through clinical trials and approved for emergency use, and they have efficacies of over 90%. So in fact, they found that a combination of Soberana 2 and Soberana Plus for infants gives an efficacy of about 98%. So it's quite astonishing, world-leading results. On the 26th of March, again, the latest figure that I could find, nearly 90% of the population was fully vaccinated. But in Cuba, full vaccination from the beginning was 3 doses, whereas, for example, in the UK, it was 2 doses, then they began to give boosters. And this put Cuba second in the world, but the Cuban statistics included their infants. They were first in the world to vaccinate 2-year-olds and up. And this graph, it's in Spanish, but on the right, you can see the total confirmed cases is now over 1 million. So that's a lot for a population of 11 million. The current case is 4,000, and the number of deaths is now 8,500. Okay, so for those of you who like to see things in graphs, we're looking at these 3 graphs. The first one is total coronavirus cases in Cuba, and this is a illustration of what I was saying. So you can see the blue line is very low all the way to, starts climbing in January, carries on, starts to shoot up at the beginning of summer, sort of May, June, and then it shoots up exponentially. And if you move along to the middle graph, you can see a story that almost matches it statistically, and that is the total deaths in Cuba. However, if we look, the interesting point here is to look at the final graph on the right, which is case fatality of COVID-19. And what you can see is at this point in summer 2021, when cases and deaths are soaring, actually the fatality rate is remaining extraordinarily low, and in fact under 1%. Okay, so how does that compare with other countries? Let's look at Cuba's case fatality rate for COVID-19. I've got this graph here on the left, which is comparing Cuba, the United States, the United Kingdom, and the world. And the line on the bottom, the pink line, is Cuba. So as you can see, all of those lines go up. And most extraordinary is the line for the United States. And then they all come down. So the Cuban line is really the flattest. And now I've introduced this graph here on the right, which is GDP per capita over a 100-year period, 1918 to 2018, Cuba, the US, UK, and the world. Well, why is this important? Because what it shows us is that the capacity to deal effectively and save lives in the COVID-19 response is not a reflection of a country's wealth. So you can see here, Cuba is again the bottom line, but this time it's a negative fact. And the line of Cuba is, below the world GDP per capita and absolutely shadowed by that of the United States. So there must be some interesting factors behind understanding Cuba's response. Okay, so the first thing is to discuss what Cuba did in the first period. Cuba on the offensive against COVID-19. So the first set of bullet points here is actions taken by Cuba before the first case was discovered in Cuba, which was on the 11th of March. So from January to March 2020, I remember that I hardly really knew about the pandemic. I hardly heard about it on our national news. In January or even into February, it started to enter more. But immediately, the Cubans had set up a national intersectorial commission and a national plan for epidemics, and they introduced surveillance at entry ports. Cuban specialists went to China. They have a very good relationship with Chinese medical scientists, and they began to reorganize their medical facilities so that they had separation for COVID cases even before they had any. And all their staff were trained, including staff who were not medical, but maybe porters and taxi drivers. They set up a medical science group to develop COVID-19 tests, diagnostics, treatments, and vaccines. Now, remember that Cuba is blocked from accessing much of the of the latest technology because of US sanctions, and we'll talk more about that later. So the 11th of March, they had their first case. What were the next steps? Well, their universities were closed as they were around the world. So they galvanized or mobilized 28,000 students of medicine to join the family doctors, which have clinics in every neighborhood. And they teamed up and went door to door, knocking on doors, asking after everyone's health, chasing after symptoms, doing health checks. So testing, contract tracing, and isolation centers. So when people were suspected of having symptoms, they were withdrawn from the community and put in isolation centers and tested and kept there until it was confirmed. And then their contacts were also withdrawn. People in the beginning with COVID in Cuba were taken to hospital to have medical supervision. They also implemented a strict lockdown. So schools, workplaces, everything was closed, centers and so on. But they provided support, financial support for people who were not at work and welfare protection, delivering goods to people and so on. They closed their borders, which was a very big deal for them on the 24th of March. And they allowed Cubans outside of Cuba to return to the country if they could find transport, but they had to enter supervised quarantine for 2 weeks and be under surveillance. And they also had huge community mobilization and daily communication. So this guy, Francisco Duran, was on the television. He's from the Ministry of Public Health every day, saying exactly how many people had COVID and where they lived and who they'd been in touch with. And they had community mobilization. So in every neighborhood, they would have neighborhood meetings and discuss and advise people about symptoms and reassure them. Now, I argue there are 5 features of Cuban development which help to explain Cuba's response. The first is Cuba's single, universal, free public healthcare system, which seeks prevention over cure and is based on a network of family doctors who are responsible for community health who live among their patients. So in every neighborhood in Cuba, you have a doctor's clinic and a doctor and nurse team. And either the doctor and their family or the nurse and their family live there and are available 24 hours a day. They have also categorized all of their patients so they know who has, for example, respiratory problems. So if there's a respiratory disease like COVID-19, they know who are the vulnerable patients and can give them extra care. In these clinics, in the mornings, people can go in and see the doctor and the nurse. And in the afternoon, habitually, they go and visit their patients. They have a duty to visit each patient at least once a year, and they regularly visit the vulnerable ones. And what they're doing is they're looking at not just the clinical situation, but also what they call the bio, social, and environmental situations. So they're looking at how people's housing conditions or local sewage or anything else can affect their healthcare. It's a very holistic approach. Cuba can do this because it has the world's highest ratio of doctors per person. They have 9 doctors for every 1,000 people. In the United States, it's just 2.8. So it's 3 times better, more than 3 times better. And in the UK, where we do have a national healthcare system, it's 5.9. The second feature of Cuban development that explains their response is their biotech or biopharma industry, which is entirely state-owned. There's no private interest, there's no stockholders or shareholders, and it's channeled to meet the public healthcare needs of the population. It produces 60 to 70% of the medicines that are consumed domestically, and it exports to 50 countries before COVID and before the vaccines. Cuba Pharma, which is this sort of umbrella organization for over 50 R&D institutes, adapted and produced new treatments for patients. So they had things, antivirals and things to stop the inflammatory response in the lungs, which was very deadly, is very deadly. And they also developed those COVID-19 specific vaccines. So Cuba has 5 different COVID vaccines. As I said, these are all what's called subunit protein vaccines. So they're using vaccine platforms that are tried and tested in Cuba, that have been used, for example, for their hepatitis B vaccine for 30 years and used with the youngest of infants. They have had very high efficacy and safety, particularly for infants. So it's clear that when they sat down to design their COVID vaccines, they had infants in mind. Okay, the third feature is Cuba's experience in civil defense. And you can see this picture here, someone is being rescued on a boat during flooding. Now, this is usually in response to climate-related natural disasters. Cuba is very susceptible to hurricanes, which bring upswelling and flooding. So civil defense and disaster risk reduction. And this was a system that was set up in 1963 after a very devastating hurricane called Hurricane Flora, which killed thousands of people. And the Cuban state said, right, we need a system to deal with this. So you have the civil defense, which operates at a national level, and then it cascades down. So you have the offices in the provinces and the offices in the municipalities and down to the neighborhoods. So all the neighborhoods in Cuba have a team that works there that's monitoring any climate related or other threats, and is immediately mobilizing the local population to respond. So local people, I mean, I've been in Cuba during Category 4 hurricane, and you know, the people living there, they know what their role is in that scenario. So someone might know their role is, if the hurricane's going to hit, to take vulnerable people to a shelter. Excuse me. Someone else might have the role of going out and clearing debris when it's passed. And this is an internationally applauded capacity to mobilize national resources and protect human life. And as I said, it's achieved through a network of grassroots organizations which facilitate communication and community action. So when a hurricane is approaching, it's constantly on the news and everyone knows what the situation is. The fourth feature is the Cuban experience with infectious diseases and border controls. In fact, they have a history pre-revolution of focusing on infectious diseases. Carlos Finlay in the 19th century made the very important discovery that mosquitoes carried the yellow fever, and so action could be taken, saving many, many lives. Since 1959, 6 diseases have been eliminated through vaccines introduced by the revolutionary state, and infectious diseases mortality rate is under 1% constantly, including during COVID, apart from that initial period. So Cuba has well-developed procedures for quarantining people who are entering or re-entering the island. Partly this comes from decades of sending tens of thousands or hundreds of thousands of Cuban medical professionals, soldiers in the 60s, 70s and 80s, other development aid workers all over the world to countries which have infectious diseases that are long since eradicated in Cuba. When they enter the island, they automatically go through a quarantine process, quarantine procedure. And this is led by the what's called the IPK, the Institute of Tropical Diseases. And the other aspect where this comes in, has played an important part, is when Cubans invite people from overseas to come and study or get treatment in Cuba, they also have to pass through quarantine to make sure they're not introducing diseases back into Cuba that have been eliminated. So this brings us to the feature number 5, Cuban medical internationalism. Now, this occasionally pops into sort of international consciousness when something happens, like it's announced that over 250 Cuban medics are going to combat Ebola in West Africa. And, you know, there's these reports and people say, well, how's it Cuba? How's that possible? Why, you know, where does this come from? But actually, those of us who studied Cuban medical internationalism know that it has its roots in 1960, which was the first time they sent medics overseas. So 1960, I mean, at the time of the revolution, Cuba had a little over 6,000 medics, physicians at all, and that was operating in the private system. Half of them decided to leave Cuba in the first years of the revolution. They weren't interested in staying with the transition to socialism. So Cuba definitely had a major shortage of medics. And yet in 1960, when Chile had a devastating earthquake, the worst on record at that point, they sent some medics to provide emergency aid in Chile. And they didn't even have diplomatic relations with the government of Chile at that point. Since then, well over 400,000 Cuban healthcare professionals have operated in 164 countries, a vast majority of countries in the world, and certainly all of the countries of the global south. There are different forms of medical internationalism. First are the emergency brigades, like the one that went to Chile, like the ones that went to combat Ebola and save lives in West Africa, and like the Henry Reeve brigades, which went to 57 brigades went to over 40 countries to combat COVID-19. The other form of medical internationalism is providing public healthcare overseas, so helping governments and local authorities to establish a public healthcare setup and situation. And this started very early as well. The first example is 1963, when, having supported the Algerian forces of national liberation struggling for independence from France, they returned when Algeria had its independence with over 50 doctors and nurses to help to set up their public healthcare system. And they subsequently went all over the world, particularly in the 60s and 70s and 80s. They helped to do the same. They were running comprehensive public health systems all over Africa. Without stopping the assistance to Africa from the late 1990s or 2000s, a lot more focus was on Latin America. And obviously with the relationship with Venezuela, some of you have probably heard about the Oil for Doctors program, and Cuba had nearly 30,000 medics operating there for 20 years, helping to run public healthcare in those countries. The third form of medical internationalism is treating patients in Cuba. So this again began with what happened when they sent people to Algeria. They brought back orphans and wounded soldiers from the liberation struggle, and they gave them treatment in Cuba. But the best example, and probably the least known example of a big program to treat patients in Cuba, is known as the Children of Chernobyl program. And that was after obviously the nuclear disaster in Chernobyl, which happened at the end of the 1980s. But in the 1990, the Cubans were made aware that there were many children in particular that were having secondary effects. They were having cancers and leukemia and other effects resulting from the nuclear meltdown. And so they started to invite these children to get medical treatment and also just to get away and rest and recuperation on a beach resort in Cuba. What happened, those of you who know a bit of the history of Cuba will recognize that, 1990, 91, this is the start of what's known as the special period of economic crisis in Cuba, where Cuba's GDP plummets 35% with the loss of its main trade partner, the USSR, and the socialist bloc countries. It lost 87% of imports and exports and has a devastating shortage of everything, including oil imports from Russia, which fall from 13 million tons in 1989 to 0 in 1992. So, a devastating situation. And yet they maintained the Children of Chernobyl program. So that by 2013, 26,000 people from Ukraine, mainly from Ukraine, and also a few from Belarus and Russia, had received free treatment in Cuba. 24,000 of those were children. Cuba never received a penny from the Ukrainian government or anyone else for this program. So the fifth form of medical internationalism, it's actually the fourth, it says fifth there, is training healthcare workers in Cuba. So I have a photo here. I was going to say I have a photo of students who are from all around the world, and they are holding their banners, their flags rather, to show that they're from all around the world. And they are students at the Latin American School of Medicine. But I believe we're being joined tonight by 2 US graduates of the Latin American School of Medicine. So hopefully they'll be able to talk a little bit about their experience. But just to say, this school was set up in the late 1990s after terrible, Cubans sent an emergency brigade to Central America. There'd been mudslides and terrible fatalities, terrible deaths. But what they realized is even after their emergency doctors had gone, people in general would continue dying unnecessarily because they didn't have a healthcare system. They didn't have access to medics. So they decided to open this school. It was called the Latin American School of Medicine, and originally was just for Latin Americans to train doctors, and it was completely free, 6 years of training. And if they need, some initial education before that was included. And the idea was that they would then return to serve poor communities. But then fraternal governments all over Africa and Asia said, well, what about us? Why can't we send students? So it's ended up being a very international school indeed, and has, thousands of students graduating every year from all over the world. Okay, so prior to the pandemic, there were already 28,000 Cuban healthcare professionals working in 59 countries. And of course, they shifted their focus to dealing with COVID-19 patients in addition to the Henry Reeve brigades. And on the 21st of March, so before Cuba shut its borders, but 10 days after its first case, the first Henry Reeve brigade arrived in Lombardy, Italy, which at that point was the epicenter of the pandemic. And I remember Italians on the news being interviewed and saying, you know, why is no one helping us? Where's Europe? Why aren't we being helped? And everyone was running away from Italy, and the Cubans, of course, ran straight into the epicenter of the pandemic. And the brigade is called Henry Reeve, by the way, because it was given that name after Hurricane Katrina, which was, I think, 2004 in the United States, which was absolutely devastating. And many people died exactly when it happened, but many were, you know, could have been saved. And Cuban doctors began to gather at the airport in Havana with their backpacks full of medicines and diagnostic equipment. They're the best trained for being in emergency situation when there's no electricity, there's no high-tech equipment, and they were ready to go and give assistance to the people of New Orleans and surrounding areas. But their offer of assistance was not even acknowledged by the Bush administration. So they kept the name Henry Reeve, and within a month there was the earthquake in Kashmir, and off they went, set up 32 field hospitals there. So they've had plenty of natural disasters to keep them busy, and they've been to dozens of countries. Okay, so what has been the biggest obstacle for Cuba's response to COVID-19? Oh, I'm trying to capture in this picture, you know, pharmacy shelves that are emptying. 60 years of US sanctions. I just wrote an article that appeared in Jacobin magazine on Sunday about how the US sanctions are an act of war against Cuba. They are the longest and most comprehensive set of sanctions in modern history. And one thing to make absolutely clear is that they are not bilateral. They do not just affect trade between Cuba and the United States. So there's a big myth where people respond and say, well, Cuba can trade with the rest of the world. In fact, the sanctions are designed to be extraterritorial. They obstruct Cuba's trade and financial exchange and even donations globally. It makes everything very, very difficult. For example, when we're talking about medical equipment, the US sanctions prohibit any country, any company or any country, third parties, selling to Cuba equipment if 10% or more of their components are manufactured by a US company or a US subsidiary. So it has been extraordinarily difficult. The total cost of the blockade, as the Cubans call it, and I would call it, has been estimated at over 144 billion, which is a lot for an island with a small economy. And Cuban, before the increase in sanctions under Trump, Cuban economists had calculated that as being 12 million every day. So if you think what 12 million can buy in Cuba, if any of you have been to Cuba, you know, you set your head spinning on what could be done with that money if Cuba wasn't blocked from normal trade. The Trump administration added 243 measures, coercive measures, actions, and sanctions to a blockade that was already 6 decades long. So, you know, if you'd asked me and many others, how can they increase the blockade? We would have struggled to think how, but they did find 243 new ways, and 50 of those were during the pandemic. So when international organizations were calling for sanctions to be lifted, and particularly sanctions that would obstruct the capacity of countries to deal with the pandemic, the United States government was doing the opposite. So in this year of COVID, April to December, just those months, the cost to the healthcare sector in Cuba was losses suffered because of sanctions was $204 million. The US blockade during the pandemic directly and in a way that has been proven has obstructed its access to ventilators, spare parts, reagents. That's the sort of key chemicals that it needs, even for its COVID-19 vaccines. There is evidence that Cuba's COVID-19 vaccines were delayed by, the rollout was delayed by 2 months because they couldn't get a specific reagent which is produced by a handful of companies, mainly US. And it's quite possible, many people believe, that if that hadn't happened, they wouldn't have had that deadly surge that you saw in those graphs early on. And the ventilators is simple. They used to buy medical ventilators for, you know, helping people breathe. They used to buy them from a Swiss company. But at the beginning of the pandemic, all ventilator manufacturers and other related manufacturers were bought out largely by US companies. The Swiss ventilator manufacturers were bought out by US companies and therefore said, we can't sell to you, to Cuba. But Cuba said, well, can we have spare parts for the existing machines that we have? Some are broken down. They said no. So, you know, this is a terrible situation to be in. And, you know, it forges the Cubans to be creative and inventive and solve problems, but it wastes a lot of energy and a lot of money. So once they developed their vaccines, they struggled to get syringes. The main syringe producers internationally are all linked to the US somehow. They either share a manufacturing facilities with a US company, or they could buy some component. So actually, the Cuban state relied on the international solidarity movement to donate syringes. And I believe that more than 6 million syringes were donated directly from the United States. Okay, so if we want to think about what distinguishes Cuban exceptionalism, we could maybe sum it up with these few points. Post-1959, there was a commitment, a political and ideological commitment to free, universal public health and education. They are endorsed as human rights in the Constitution. And this is really important, the early investment, because it creates the critical mass of medical students, but also medical scientists, which played such an important part in the biotech sector, which I'm going to go on and talk about. The state has control in a planned economy. This is really important. It means that they can harness resources, they can channel resources. There are no private interests or speculation. There's no conflicts of interest. Next, the political will of the government. And it's clear that certainly in relation to biotechnology, when I was doing my research, this came up over and over again. Fidel Castro was a real protagonist in this. In fact, there's this incredible fact that in January 1960, just 1 year after they've seized state power, Fidel Castro goes to the Academy of Sciences. Now think of the context. You have 2/3 of the population are functionally illiterate. So 1/3 has no literacy and the other third has had 3 years of schooling altogether. You have, you know, children running around barefoot with bellies full of parasites in the countryside. And Fidel goes to the Academy of Sciences and says, the future of Cuba will be a future of people of science. We are creating opportunities for people to put their intelligence to the good of the nation, for a just cause and the development of the nation. So, I mean, the whole story about how biotech starts with the development of something called interferons is very much driven by Fidel Castro. So like him or not, he clearly has a very key role in this development. They also have this long history of infectious disease, research and vaccinations. I mentioned Carlos Finlay. Actually, even Obama mentioned Carlos Finlay when he went to Havana on a historic visit in 2016. And they have this integration between universities, research centres, medical science enterprises, and the public healthcare system, which is facilitated by the fact that they're all set up and controlled by the state. So there's no proprietorial interest. They're all working on a collective project and endeavour. Okay, so if any of you have seen the documentary Cuba Covid-19, which we produced, Public Health, Science and Solidarity, which we produced in November 2020, before their really awful surge in Cuba. I think at the time we produced it, there'd been about 40 deaths. This is how we ended it. What were the lessons from Cuba? Cuba spends a tiny proportion of what Britain, the United States spend on healthcare. Despite this, by planning their scarce resources, they have been capable of organizing an effective response to a global pandemic. The key to Cuba's success has not just been the fact of state intervention, it is the nature of that intervention. Cuba's socialist system is set up to prioritize social welfare, not private profit. That may not be a lesson that other nations are ready to hear, but Cuba's international assistance during the pandemic at least shows the benefits of global cooperation and solidarity for addressing global problems. Now, I have some time left, so I hope you'll find this interesting. I've decided to have a little closer look at Cuba's biotechnology sector. So, I mean, I mentioned this quote already, like 1960. I'm going to just give an overview of investment post 1959. 1960, Fidel Castro at the Academy of Sciences, his comment about being Cuba's future being a future of people of science. 1965, they set up the National Center for Scientific Research, known as CENIC. And it's given the brief of, among other things, initiating biological studies and a new scientific infrastructure for the country. Now, the interesting thing is many of the young students who entered CENIC subsequently became the leading directors and scientists in Cuba's biotech R&D institutes. And this is one of them, Agustin Laje. He, when I interviewed him, he's recently retired. He's for many years, the director of the Center for Molecular Immunology. And he was regarded in America's Quarterly as among Latin America's top 5 academics. The SIM, his institute, is the one that has produced this innovative Simovax EGF cancer immunotherapy, the first in the world to produce a immunotherapy treatment for lung cancer, and that has the capacity to be adapted for many other cancers. And it's a complete exception in the sense that it is now being trialed in the United States by Roswell Park Cancer Institute, Buffalo, which managed to slip in at the perfect moment when Obama was prepared to issue licenses for some collaboration. So that trial is underway. Okay, in the 60s and 70s, thousands of Cubans trained as scientists and engineers. They went abroad, they went to Eastern Europe, but they also went to the West. And Cuba achieved a ratio of 1.8 researchers per 1,000 inhabitants, which is close to the European level of 2 per 1,000, far above the Latin American mean of 0.4. In 1975, they set up a National Council of Science and Technology, and the new National Scientific Policy was approved at the first Congress of the CCP. By 1986, Cuba had 39,000 scientific workers. That's 1 for every 283 people. And of those, 23,000 were involved in research. So they have this critical mass that is required to do the kind of innovative work that they do. Okay, so what's going on? Where does biotech come from globally? The biotech sector was launched in the United States, and it's launched by a biochemist and a venture capitalist. And that becomes a common feature of the biotech sector. So the first company is 1976, Genentech. The second company globally is 1980. In Europe, it's the 1990s, and then Japan, Singapore, and China. Now, interestingly, it did not achieve profits from profit sales internationally until 2009. But there's something that they call in the literature the Pisano puzzle. And that is that despite that, money from venture capital and big pharma poured in. Why? Why do profit seekers pour their money in this field? Because they use financial mechanisms that enable stock market investors to profit by trading biopharma stock, even without a commercial product. Biotech products can take up to 20 years to commercialize, and by 2002, there were only 100 biotech related drugs had reached the market in 26 years. In 2011, most biotech firms doing these IPOs, initial public offerings on the stock market, are productless. So it's a multi-billion-dollar industry, but is it serving the function that you imagine it served, to produce innovative drugs to save and cure people? Okay, now this is not to say that there isn't public money in biotech. There is a great deal of public money. In fact, two researchers in this field say the biopharmaceutical industry has become big business because of big government and remains highly dependent on big government to sustain its commercial success. So government funds basic science through the National Institutes of Health. It heavily subsidizes the training of medical researchers. It decides what drugs or therapies to include in healthcare programs, and Congress sets patent policy. So what you can see, well, I'll get to that in a minute, the graph in a minute. The FDA regulates manufacturing and commercialization conditions. So it's very controlled, facilitated, incentivized by the state. There's also legislative support for capitalist biopharma industry. So really key, 1980, very early on in the development of the sector, you have the Bayh-Dole Act, which gives private property rights to new knowledge from federally funded research. So if you look at this graph here, you can see patents issued to US universities. So this is, universities with public money, they're producing goods which are then privatized and the profits owned privately. 1980, the Supreme Court says genetically engineered life forms are patentable. And in 1983, you have the Orphan Drug Act, which also massively determines what's produced and in whose interest. So the question is not public money or not public money going into the sector. That's not what distinguishes Cuba. The question is who controls production and distribution and in whose interests. And arguably that counts for every sector of the economy. So let's move on to the curious case of Cuba. This biotech, Cuba's performance here, is the first time that Cuba has been incorporated into an emerging industrial sector. And Cuba's sector emerges independently from the USSR, the Soviet Union, and from the corporate capitalist model in the US and Europe. It's distinctive. And here's another astonishing fact. It starts with something called the Biological Front, which is set up in 1981. So that's just 5 years after the world's first biotech company and 1 year after the world's second, before Europe and before the other countries I mentioned. $1 billion was invested in the biotech sector by the end of that decade. And $1 billion, again, I reiterate, is a lot of money in Cuba. This was very much an initiative of the government and of Fidel Castro. So what happens with this money? They set up something called the Western Havana Scientific Pole, also known as Science City. And it has 52 institutions. Some will be producing equipment and testing. Some will be doing the research on innovative drugs. Now, what happens at the end of the 80s, as I've already mentioned, collapse of the Soviet bloc, collapse of the USSR, 34% fall in GDP, the special period, economic crisis management, belts are tightened, cuts in every sector, scarcity, austerity, but 3 sectors in the economy are protected: food production, tourism, and biotechnology, which becomes protected directly from the president's office, that's Fidel Castro. And in this period of economic crisis, 1990 to 96, another $1 billion or 1.5% of Cuba's GNP is invested in the scientific pole. Now, when you think about the fact that I already mentioned of how risky this is, money can be poured in and no products produced, products taking 20 years to be commercialized. This was a very big, bold move, a big risk to take. Okay, so how does this start? Well, it starts with the interferons story, and it starts really by with a testimony to the benefits of US-Cuba collaboration. So it starts with this man in the picture you see handing something over to Fidel Castro. It's Dr. Randolph Lee Clark. He's a US oncologist, and he visits Cuba on a sort of health trip at the end of the Nixon administration, when the it's not Nixon, sorry, Carter administration, where there's a brief flaw in relations. And Fidel Castro asked him, what's the latest in cancer research? And he says, we're all looking at interferons. This is the wonder drug of the future. Now, interferons are actually a protein that your body produces. It's a signaling protein. So when a pathogen enters a cell, it produces interferons, which alert other cells to be on standby and get ready to produce a response. Now, I'm not a medic, so for those of you, if I've killed it with my explanation, I apologize, and you can take over. But the point is that Randolph Lee Clark says to Fidel Castro, I'll take one of your researchers. They can come to my laboratory, and Fidel Castro persuades him to take two. So they spend a few days with Randolph Lee Clark, and he puts them in touch with a guy in Finland, Kari Cantel, who is doing work on interferons and has managed to separate the interferons from their material so it can be used as a product, as a drug. And Kari Cantel invites a group of Cubans over to Finland. Now, they're only there for 2 or 3 weeks, and they learn this procedure, return to Cuba, and within a very short amount of time, they have mastered the procedure. They send their product to Finland, to the Finnish laboratory, and the quality is confirmed. And it turns out it's just in time, because Cuba is suddenly experiencing a dengue epidemic. Now, dengue is another disease that comes from mosquitoes, but this is a particularly virulent strand that has never been experienced in the Americas before. And 180 people have died, 101 of those were Cubans. The Cubans accuse the CIA of introducing it as a biological warfare. The State Department denies it. This is a sidetrack story, but there is now a newer study by Cubans which claims to have bioinformatic evidence that in fact it was pertaining from US laboratories. That's a side story. The epidemic is there. So the Ministry of Public Health decides to give interferons the go-ahead to use them in a prevention and therapy campaign, a public health campaign. And it's the most extensive prevention and therapy event with interferon carried out in the world at that point. Remember, interferons were being developed in relation to cancer, but this is using it in a different way, in a sort of antiviral mass public campaign. So Cuba then takes interferons, as this is Luis Herrera, who was involved in this. He was involved in the Center for Biotechnology and Genetic Engineering. He says, we've taken interferons as a model for the development of biotechnology in our country. So that helps to understand the Cuban approach to immunotherapy. Interferons, the medicine is about getting your body to raise up its own defense and to fight a disease itself. And that becomes the model for the Cubans. And they go on and they advance their work with interferons, and they clone it in yeast and so on. And they develop something in 1986 called interferon alpha 2B, which is a distinctively Cuban product in the sense that it has distinctive compounds and so on. And this product is used frequently in Cuba. From 2003, it's produced in China through a joint venture. Now, when COVID-19 strikes, I think, well, it struck from the end of 2019, but in 2020, when the Chinese national health authorities were compiling a protocol of treatments, they adopted Cuba's interferon alpha 2B, and seeing its very good results, it went up the protocol for antiviral drug treatment. Okay, so that was a case of, using this sort of research and so on to meet public healthcare needs. There's another amazing example of this, and this is the meningitis B vaccine. So in the 1970s and 80s, Cuba was suffering from meningitis B and C cases, and they were gradually rising. The Cubans managed to get a vaccine for meningitis C, but no vaccine for meningitis B existed anywhere in the world. So they said, right, well, we have to create one ourselves. And this woman, Concepcion Campo, you can see here, very smiling, she leads a team to produce a vaccine, and they work tirelessly until in 1988 they can say they have produced the world's first meningitis B vaccine. And they follow this up with a combined vaccine for meningitis B and C, which is domestically produced and part of Cuba's infant vaccination program. But if you look at this graph here in the blue, this shows the incidence of meningitis B. You can see it's zooming up. And then the vaccination campaign starts in April 1989, and you can see how that line plummets. Augustin Laje, who was the man featured in the magazine, he told me when I interviewed him in Havana, I tell colleagues that one can work 30 years, 14 hours a day just to enjoy that graph for 10 minutes. So I think that process is interesting for what it tells you about their motivations as anything else. Okay. So in summary, what are the distinctive features of Cuban biotechnology? It's founded with 100% state investment and finance 100% from a state budget. But they also have this closed economic cycle. So money that the R&D institutes make exporting gets plowed back into those same institutes. It is state owned. There's no private interest, no shareholders, no speculation. Profit is not sought domestically. So they're not selling the goods into the public healthcare system for a profit. There's no profit sought domestically. The institutes operate under the framework of cooperation, not competition. So they get together at least once a month. The directors get together and they talk about what they're doing, what resources they need. So it's resource and knowledge sharing. And for many years, I was told Fidel Castro actually attended those meetings. So, and because it's designed to meet public health needs, there is a fast track from research and innovation to trials and applications. So they can do this. That's how they were able to do the meningitis B vaccine, to do the COVID vaccine so quickly. They have these multidisciplinary teams that take project from the basic science to production. So in most countries with biotechnology, you have different companies set up for each step. And what that means is one company will do the basic science, but then they need to sell their product or knowledge to another company, and then they need to sell it up to a company, and it becomes extremely complicated, and many very good ideas can disappear because there isn't perceived to be a market for them. Integration into the public healthcare system and education system, which I've already talked about, and a fluidity between the R&D institutes and enterprises, universities, and the Ministry of MINSAP is the Ministry of Public Health. Medicines that Cuba cannot afford or cannot access due to the US blockade, so that would be US patented medicines, have to be produced domestically. And that's how Cuba gets this astonishing record of 60 to 70% of its medicines produced that are consumed domestically, are produced domestically. Dr. Kelvin Lee, who is leading the research in Roswell Park on the cancer immunotherapy, said, the Cubans start with identifying a need and then figure out the science to develop that in the lab, manufacture their agent, test it in the Cuban medical system, then commercialize it and sell it overseas. Okay, so what have been the fruits of the Cuban system or the Cuban cure? I've got here 10 gold medals from Cuban professionals from the World Intellectual Property Organization during 26 years. But I've just read a news report saying they've been awarded another gold medal for their COVID-19 vaccines. So I might have to change that slide. World's first meningitis B vaccine. They have something called Hepripot P, which is a treatment for diabetic foot ulcers. This reduces the need for amputations by 72%. So someone calculated that if patients in the United States had access to the Cuban drug, over 50,000 people in the US who have amputations would not need to have them. So, you know, the blockade is not just, the detrimental effect is not just one way, it also denies people in the United States from the benefits of the Cuban system. They have vaccines for hepatitis B and dengue. You see here this graph, this shows morbidity rates for hepatitis B in Cuba. Again, you can see what happens once they introduce their vaccine, which is domestically developed and works on the same platform as I said, was one of the COVID vaccines. They have the world's first human vaccine with a synthetic antigen, the first therapeutic lung cancer vaccine, which I mentioned, the Sinovac EGF. They developed their own ultra microanalytic system for prenatal diagnosis. They were the second in the Americas after Canada, before the United States. They produce 57 million tests every year for 19 conditions. This is as data from pre-COVID. 8 out of the 11 vaccines, which are given as part of the childhood immunization program, covering 13 diseases, are produced by Science City. It's an astonishing achievement. They're the first in the world to eliminate mother-to-child HIV transmission. By 2017, they had 182 inventions and products marketed in 49 countries and partnerships with 9 countries. They today have the highest rate of doses of COVID-19 vaccines per person, and their data includes infants. All of their 2-year-olds and up have been vaccinated. Okay, so going back again to say something specifically about the impact of sanctions, I'll just read this quote. I've said the rest. This is from the New York Times just over a year ago. Producing the coronavirus vaccine was made more complicated by the Trump administration's tightening of sanctions on Cuba. Scientists say they haven't been able to buy all the equipment and raw materials they need, including spectrometers used for quality control. The 2 research groups working on the drug have only one that is powerful enough to analyze the vaccine. Dr. Guillen, who is someone who appears in our documentary, said it's about 20 years old. Cubans are not only able to make old cars still work, they can manage to make old equipment, said Michel Valdez Sosa, the director of the Cuban Neuroscience Center. So as I said, they had subsequent problems with reagents and syringes. Okay, so to end, I didn't want to end on that really rather negative note. So just to end on a more hopeful note, and this is with Cuba's pledge to give what they call a life-saving package of COVID-19 vaccine support to the global south. So Cuba's population is close to fully vaccinated, but they're not going to shut down their production facilities. They're going to carry on producing for export. Tens of millions of doses, they're saying, are available. And the Cubans have offered formally to give solidarity prices for COVID vaccines to low-income countries. So they've already made donations to quite a few countries that are poorer nations. Secondly, to engage in technology transfer, where the host country, where another country has the technological capacity, the Cubans will facilitate them to produce Cuban vaccines in those countries. And really importantly, to extend the medical brigades around the world to build the medical capacity and training for vaccine distribution in partner countries. Because it's one thing to have the vaccines, but what the Cubans have been so good at is rolling them out and getting the shots in the arms. And this graph here shows you why Cuba, the Cuban vaccines, and their offer of solidarity prices and donations is so important and is the best hope for many populations around the world. What you can see is the countries in red, including more or less most of Africa, are not on track to meet the goal of having 70% of the population fully vaccinated by 2022. So there's a massive global disparity in terms of access to those vaccines. I believe that only 14% of the population of Africa has received even one dose of COVID-19. Okay, that was just 1 hour, so I will stop there. Thank you very much.
How can we reach you to share this information in our communities? Oh, boy.
So at this time, we'll probably take some questions from on-site here first. And then we would still ask just for the calm of the 300-ish people that we've got online to possibly type questions into the chat field where Helen can see those and we can take a look to go through theirs, but I'll hand it off to you.
And of course, we can't respond to too many questions, but let's say about 10 minutes for the on-site people and about 10 minutes for the people who have their questions in the chat.
I'm wondering, in terms of all the inventions that the Cubans have made in pharmaceuticals, how do they keep big pharma from the United States from basically stealing their medical knowledge, patenting it, and then making it unavailable to them?
Do you want me to come back to that now, or are you going to take a few?
Should we just do one at a time?
Yeah,
Is that
one
fine?
at a time.
You can go on, you can answer that right now if you like.
Okay, so I have a chapter in my book about the development of biotechnology, the curious case of Cuban biotech revolution. And in it, I discuss how it develops, but also how they develop their relationship with, or their approach to dealing with international companies. Because very early on, I mean, they needed finance, they needed capital. Very early on, they did a deal with a Canadian company, but they, I think it was, I can't remember what it was called. It was for some neck cancer or something. And they felt that they got really shortchanged in the deal because the Canadian company promised to give them a lot of money to help in the development of the product. But when it came to marketing it, the Canadian companies sort of made a lot of profit, and the Cubans, I was told that the Cubans behind this said to the government, look, we can't carry on like this. I mean, we've done all this hard work and we're not even getting money to reinvest into the sector. So they said, the state is going to have to come up with that money. So the approach of the Cubans now is they are interested in joint ventures and collaborations, but not at the stage of drug development. What they need assistance with is industrial production because of the high cost of the technology and so on, and also marketing overseas. So the Cubans are, they learn quickly, they're very savvy. And in terms of the product that's being trialed at Roswell Park, I mean, I think they obviously have worked and communicated with Roswell Park for many years, and they've established a relationship of trust. They now have a joint venture, but the Cuban product is already patented in Cuba and globally. It's already being exported to, I don't know how many countries, but quite a few countries. It's been used by tens of thousands of people, this lung cancer immunotherapy around the world, as well as in Cuba. So I think it would be very difficult to for any theft to go on. But I do understand your point. I mean, there's a general distrust for profits motivated biotech companies.
Hello, Dr. Yaffe. We are I'm Olive Albanese.
Hello, I'm Dr. Alexandra Skeeter.
We were trained in Cuba at the Latin American School of Medicine, and we're very happy to see you and hear you, and thank you very much for your wonderful presentation.
Yes, so we were actually both born at St. Joseph's on the north side of Milwaukee, and we met in Cuba, and we got the chance to be classmates. And so Olive she just matched. So big congratulations to Olive. We both graduated, but she's going into the match this year. So she'll be working as a family medicine resident. And then I'll be applying this year as a obstetrics and gynecology resident. And so, yeah, we're so happy to be here. And if anyone has any questions, there is a lot to talk about. So,
And everything you were saying about how the blockade is affecting Cuba is very true because we worked our last year in Cuba in the hospitals and it was very scarce. All of the supplies were so scarce. It was almost heartbreaking to see the struggle, the daily struggle of all of the doctors and nurses and everyone, just basic things that we take for granted here in America, like paper, gloves, all of the medical supplies that were in short because of the blockade. So as soon as we can get this blockade lifted, it would be better for everyone.
if there's any questions we can ask, I know there's people who.
I have a question. Can you guys hear me?
I can hear you.
Okay, I'm very excited to hear the main speaker. I have to catch your name, and the young lady speaking now. I host a radio show in Washington, D.C., and we would love to feature more on Cuba. Years back, we did a lot on Cuba's healthcare system, but lately I've had trouble identifying speakers. So I would love to. We have a huge interest in our community in what Cuba is doing. So I would love to know how to reach you after this is over.
Yeah, you can take down my email. It was on the slide. I think it was on the first slide. It is helen.yaffe@glasgow.ac.uk. And that's my university email.
Okay, and I think that's on the initial invitation too.
Yeah. I have a question for you, ELAM graduates. When you say that you're going to be residents, do you mean in the United States? Yeah.
Yes.
So what process did you have to go through to get your qualifications from Cuba recognized in the United States?
You have to obviously graduate from a medical school, and depending on the different accreditations, but be accredited by, well, specifically to practice in the US, accredited by the World Federal Organization of Medical Schools, by that, first and foremost. And then you have to get your ECFMG certification, which is the Education Commission for Foreign Medical Graduates. And that itself is a whole very long, tiresome process to get your certification. And then and only then will residencies or hospitals or institutions look at you once you've completed that ECFMG certification. Then you can go ahead and apply to the different institutions and programs. Alumni from our program generally applied to 30 to 40 programs all around the US. And then you go through the interview process. Lately, it has been via Zoom, but historically it was in person. Obviously, you would travel all around the country. And then hopefully they offer you a spot at their residency or at their program. It can vary anywhere from 2 residents in a class to 18 or 24, as big as, I don't know if you've heard of anything bigger than that, not even that big. And then you start, depending on the specialty, however long it goes. Family medicine's 3 years, and then obstetrics and gynecology is 4. So yeah, so we're all in mode to do that, because the mission of the school, right, was to get people of color, Black and brown students, to come to Cuba and to study medicine, and then go back to their communities and to where they came from to practice medicine. And so for that, for us, it's the US, and for us specifically, since we do speak Spanish now, you know, it's with Black and brown people. So.
We actually don't have any questions on the chat for the virtual attendees. There are lots of thank yous, and my roommate is watching this and so forth. We don't have any questions in the chat. So if you
There's
have
one.
questions-
There is one question from a
Okay. One,
Rayhan.
okay.
And I think your Elam graduates are a better place to answer. This person asked, how does Cuba recruit young people to go into healthcare? Oh, it's not young people from overseas. Okay, especially those in marginalized communities. I mean, I would be interested to know how you got to know about Elam and how you got into Elam.
Well, I found out about Elam from one of my ex, a former friend of mine who was volunteering in New Orleans after Hurricane Katrina. And so the volunteers at the Common Ground Health Clinic in the lower 9th Ward, they were all invited to study, which we have 2 graduates who were volunteers there. So I heard about it through another volunteer, and when I was in my final year of studying pre-med, and so I read the IFCO Pastors for Peace website, and I decided that's where I wanted to go. I applied, and I was very fortunate, blessed to get the scholarship.
Yes, so I was playing volleyball on a scholarship up in Minnesota, and I was pre-med. My sister was going to UW, University of Wisconsin, Milwaukee at the time, and that is when the coalition that brought up Luther Castillo, who was one of the original, I think one of the first graduating classes of Elam. And so he spoke here in Milwaukee. And so my sister called me afterwards and was like, sis, you have to go to this program. And I was like, no way am I going to Cuba for 7 years. Like, what are you talking about? But I feel like a lot of people can relate with me because here in this country, we don't talk about Cuba. You know, it's not something at the dinner table ever, or even in school, like not at all. And so I was one of those people that felt very kind of ashamed and like embarrassed that I didn't know this rich revolutionary history. But obviously, not only did I receive a medical education, I received 7 years of political education. And so I feel like I can have a great conversation now. But however, she called me, I looked into the program and I went, you know, the first year is a Spanish intensive year. And so I was just encouraged to go and give it a try, and I fell in love. And here I am 7 years later as a doctor. So thank you. And then I'm going to be emailing you later. So I appreciate your time and all of your knowledge. Thank you.
We want to share your slides.
Okay, we got one question.
This is for anyone, you two or Dr. Yaffe too, but despite the blockade and like the imperial nature the US relates to Cuba with, the medical system is so like successful and so resilient. Now, I was just wondering if you two, especially who were there and see this firsthand, what factors do you think really contribute to that resiliency despite all the like implications of the blockade on the medical field specifically?
So are you waiting? I know you, okay. I'll let them respond.
My first thought that comes to mind is the huge emphasis on primary care. So 80% of the resources go to a widely distributed universal primary care system where there's a doctor within walking distance of every single person who lives in Cuba, where they not only walking distance, but free and accessible to everyone, and everyone is everyone is counted for, categorized in each community, and given a level of 1, 2, 3, or 4. So 1 is healthy, 2 is risk factor, 3 is sickness, illness, and 4 is disability. So because every single person is counted for with one of those 4 level categories, each category determines how many visits to the doctor you get per year and how many visits the doctor makes to your home every year. And so it's beautiful that we did the rotations in the community with those doctors, where we would make house visits in the neighborhood. We would check on patients, we would check on the people with more risk factors more frequently. So this is partly why the maternal and infant mortality is so low. And what else would you say?
I would speak more to the value system that Cubans have and share, and some people don't, obviously, but for the most part, the majority of people are in favor of the revolution and are on that side. And so with that comes these huge shoes to fill, in terms of values and in terms of your worldview. I think the greatest example of resistance that I have seen is, from my perspective or experience, is is the Cuban healthcare system, is because they still go on every day. They still show up, and they have so many reasons to stop, and they have so many reasons to not come to work, but they do, and it's not because of money, so I think that's why it's something way deeper than anything fiscal.
Yes, and the values are on human life and the life of everyone, altruism. My mom was just mentioning in the car about how the president is going to invest more money in infrastructure, so that to some people in this country that means building more roads. But I said what we need is more the water infrastructure and more public housing, because homelessness is such an incredible problem in this country, where in Cuba there's hardly any homelessness. I've saw maybe a handful of homeless people in my 8 years that I've lived there. And then my mom says, well, public housing is very expensive to build. And I said, it's not more expensive than nuclear bombs. And it's like where you place your values. Are you placing your values on people or on war? So that's what I have to say about that. Yes, and Dr. Yaffe, would you like to respond to the question?
Yeah, I love listening to you two. Do write to me. I really want to stay in touch. I think you're in such a powerful position, because you are students from the United States who've grown up in that system, and yet you've had this amazing experience inside a system which is like taking what people there know and turning it on its head. And you're such a powerful in a powerful position to educate people. So I really hope that you use that incredible privilege that you've had. You were talking about how the ELAM is opening up to Black people and Latinos from the United States specifically, but the Margaret Chan, when she was the director of the World Health Organization, said this is the only school in the world where if you're Black or Indigenous or a peasant or some marginalized community, you have more chance of getting in than not. So it is incredible. I think that really key to understanding the successful outcome of the Cuban healthcare system is also the focus. It's come across in what they've said, but the focus on prevention. Now, this is a really interesting thing, right? So this is antithetical to the US system in a way. The guy I was talking to who's developing the lung cancer vaccine said, you know, in some ways, this is not what the US system wants. It's a very cheap injection that can be given to people, this cancer immunotherapy, in a mountain clinic. Yeah. And actually what the US system, a profit-seeking system where there's so many ways of making money through the, you know, the doctors, yes, and all the medical stuff, but the insurance companies and the builders of facilities and so on, they want patients to have to go through very high-tech treatments in very centralized institutions. And the Cuban system, first of all, by focusing on prevention, you like you're saying, what you're describing, you're very familiar with your local community, you're on top of their ailments, and you're detecting things before they can get to that point where they need this very expensive, very centralized and clinical treatment. So I think that's really key. Prevention is better than cure.
Yes, 100%.
I have a different perspective on your question about resiliency. I would say the si se puede, yes, we can do this attitude is everywhere in Cuba.
Mm-hmm.
And in our culture, I think we have a throwaway culture. If something breaks, you toss it away and buy another one. And in Cuba, that's not very possible. And so the attitude is, calm down, don't worry about it, we'll figure it out. And also a sense of joie de vivre. We just love life. Relax, calm down, we'll have a little fun, and then we'll think about how we're going to solve this problem tomorrow or a little bit later on. And we can do it. It's just going to take a little bit of ingenuity, creativity, and innovative spirit. So it has to do also with the values that everybody was talking about, but that perspective of values as well. Okay, I think everyone is tired out now, especially Dr. Yaffe, and we thank Dr. Skeeter and Lewinsky for coming and talking with us. And we would say a very good night and have a restful night, Dr. Yaffe. And we are so grateful to you for you spending so much of your valuable time with us. Thank you once again. And we hope that the next time, hasta la vista, we will see you here in person.
Oh, I definitely hope so. Then I won't be up at 2:30 in the morning.
Oh, one could be up 2:30 in the morning partying instead.
Partying, yeah, that's different. That's okay.
Okay, thank you again very, very much. And thank you all of the people who are virtual and all of the people here who are in person and all of the many organizations and universities that are on the virtual call. Have a very good night. Thank you once again.
Thank you.